This is Robert, 71 years old. He had a headache. His symptoms began 3 years ago. His body weight is normal, and not very active. He consumed burgers and fries every day. He also drinks wine, 2 to 3 times a week. He consulted 15 neurologists, but nobody could give an exact diagnosis and effective treatment for his headache. Robert has a headache, specifically at the back of his right eye and head. He experienced ringing in the ears, or tinnitus, numbness and tingling sensation in his legs. He was diagnosed with migraine and spiral stenosis. Treatments focus to alleviate pain. Robert was given ketamine infusion, and medications like alprazolam and Lortab. He was also given Stilnoct for insomnia. His dental implants were also removed. But his pain did not go away. There are 3 common types of headaches: tension, cluster, and migraine. Tension affects both sides of the head. Tightness sensation, like a bandage, lasts for 2 hours to a day. Mild to moderate pain. Cluster affects one side of the head. Burning sensation, lasts for 30 to 90 minutes only, but can recur many times of the day. Mild, moderate to severe pain. Migraine affects one side of the head. Throbbing sensation, like vibration, heartbeat, pulsation, lasts for several days. Severe pain. How do you know that it's a migraine? Migraine will be accompanied by nausea and sensitivity to sound, light or smells. This will produce red and watery eyes, or a runny nose. These symptoms will not appear in tension, or cluster headaches. What is the root cause of migraine? Before, migraine was believed to be a disturbance in blood flow. Now, it was believed it is caused by the heightened activity of the trigeminal system. However, the single disease process of migraine has not been identified at the moment. What happened to the trigeminal system during migraine? There is stimulation of trigeminal ganglion, group of nerves, which results in the release of neuropeptides. The release of these neuropeptides results in inflammation. Inflammation includes vasodilation and leakage of blood vessels. According to clinical observation, temporal vessels are visibly dilated during migraine. Low serotonin levels stimulate trigeminal ganglion. Accumulation over time of several stressors decreased serotonin levels. Stressors that decreased serotonin levels and/or triggers migraine are the following: food allergies. Histamine-containing foods, like chocolate, aged cheese, pickled herring, sausages, sour cream, and fermented foods. Alcohol, especially red wine. Chemicals like nitrates, monosodium glutamate, MSG, and nitroglycerin. Stress. And too little or too much sleep. Most headaches are best addressed by identifying and removing the trigger, along with implementing strategies for natural pain relief. Here are the 4 things that Robert can do to manage a headache. 1. Identify the trigger. Common triggers of a migraine headache include foods that contain either tyramine or phenylalanine. Tyramine can be found in cheese, chocolate, cold cuts, coffee, herring, smoked fish, wine, especially red wine, alcohol, sausage, sour cream, and vinegar. Sources of phenylalanine include monosodium glutamate, MSG, artificial sweetener aspartame, and nitrates, which can be found in processed meats, especially hot dogs. 2. Detoxification. 2 to 3 day vegetable juice fast can be effective for managing a headache. 3. Hydrotherapy. You can alleviate a headache by simply putting your feet in warm water and placing an ice pack around your neck. This hot-cold water strategy caused blood to move away from the head toward the feet, relieving the head of congestion and pain. 4. Take natural pain relief. Ginger. Ginger is very effective not only for musculoskeletal pain, but also for a migraine headache. Ginger can be consumed liberally as a supplement, or as a whole food, and it is safe for use in pregnancy up to 1 gram per day. Intranasal capsaicin. In a small control trial, patients stated that intranasal application of capsaicin alleviated migraine suffering by 50 to 80%. Cannabis or Cannabis sativa. The leaves of the cannabis plant are an inexpensive and impressively safe botanical, providing therapeutic efficacy against a wide range of debilitating medical disorders, especially chronic pain. Cannabis can be used as a supplement or substitute for opiates in the treatment of chronic pain. When cannabinoids of cannabis are used with opiates, it leads to greater relief of pain. Additionally, the cannabinoids can prevent the development of tolerance to and withdrawal from opiates, and can even reactivate opiate analgesia after a prior dosage has become ineffective. The plant cannabis has been used medically for thousands of years, but later made illegal for some countries. Israel allowed cannabis for medical uses.